The circulatory pathways, it happens like this. It starts from the right atrium. From the right atrium, the blood will pass into the right atrium through the vena cava. Then it will pass through the AV or anterior interventricular tricuspid. Then the blood flows down to the right ventricle. Here, right ventricle. From the right ventricle, which is on the right side of the heart, the blood will move up and out the pulmonary artery. Pulmonary artery is here. Yeah, from the right ventricle. Which is one of the most anterior surface of the heart. Then the blood will travel to the lungs to get oxygenated, and it will return to the right atrium. Right atrium. By means of pulmonary veins, which are often cut off at the backside of the heart. In here, pulmonary veins. Yeah. Then after that, the left atrium. From the left atrium, the blood enters here in the left atrium, and it passes the second anterior interventricular valve, which is the bicuspid valve. And there's a heartstrings called chordae tendineae. Here, chordae tendineae, attached to the bicuspid valve. The blood then flows down into the left ventricle here. Left ventricle. Here. Yeah. From the bicuspid valve, there's a heartstrings called chordae tendineae. Then it goes to the left ventricle here. Left ventricle. Then moving past the aortic semilunar valve, which is the thin cup-like valves that allow blood to move up and out. As blood moves back toward the ventricles, it feels the semilunar closing door shut. Then aorta, which is branching of the aorta, is brachiocephalic artery. From aorta, in here, aorta, this is behind the brachiocephalic artery. There is aorta, the hole here, next from brachiocephalic artery. The brachiocephalic artery, it will carry blood to the head, into the arms. Then after the blood goes to the head and to the rest of the body, it will return back to the right atrium in here. Right atrium. By the vena cava that pass the tricuspid valve into the right ventricle. Yeah, but right ventricle here. Right ventricle here. Out to the pulmonary artery and back to the left atrium. Left atrium. Then past the bicuspid anterior ventricular, then down to the left ventricle, and then up and out past through the aortic semilunars through the aorta. Aorta is here. Yeah. Then the left ventricle is thicker than the right ventricle. Left ventricle, right ventricle, this is thicker because the left ventricle needs to have more force from muscle contraction to be able to eject blood into the aorta, into the body circuit, which is the pulmonary circuit. That's all for the sheep anatomy. Thank you.